Access to cataract surgeries in the Bono region remains a challenging endeavor. With only 2 ophthalmologists stationed at the Bono Regional Hospital and the SDA Hospital in Sunyani, the demand surpasses the available resources. The SDA Hospital, in collaboration with the Himalayan Cataract Project and the National Cataract Outreach Program, conducted 285 free cataract surgeries. However, despite their efforts, numerous individuals in the region still suffer from cataract. To extend their services to a greater number of people, the hospital has initiated a rural outreach program. This program involves screening of individuals for cataracts in remote areas, ensuring those diagnosed with the condition are scheduled for surgeries later in the year. I had the privilege of joining Dr. Louis Otinjima, an ophthalmologist at the SDA Hospital in Sunyani, and his team on a 5-hour journey to Brody and Namasa in the Tang district, as well as Duadaso in the German North district. The mission was to screen individuals with cataracts and book them for surgeries, so their failing eyesight can be restored. During the trip, the team also provided additional medication to over 20 individuals who had recently undergone surgeries, ensuring their continued treatment.
In the Bono region, it's been estimated that almost about 11,000 people are either blind or severely visually impaired from cataracts, for whom surgical operation of their cataracts will help to improve their vision. But there are lots of barriers when it comes to people getting access to cataract surgeries, and one of those barriers has to do with costs. There are both direct and indirect costs. If you go to most facilities in Ghana, especially in the big cities, cataract surgery for one eye could cost you between 1,000 to about 3,000 Ghana cedis. Those are the direct costs. Think about the cost of transportation. There are also barriers with regards to fear. Most people are really afraid to have cataract surgery for one reason or the other. People who are blind from cataract should not be blind from cataract, because now some simple surgical procedure can be done. Within a few minutes, their eyes are closed, and then the following day, when the eyes are opened, they are able to see very well again. And that's why over the past few days, at Sunyani SDA Hospital, with the support of the Himalayan Cataract Project through the National Cataract Outreach Program, they've supported us to perform cataract surgeries at no direct cost to almost about 300 people.
Are you happy with the feedback we are getting from those who conducted surgeries on?
And we are all very happy with the outcome as we see today. Most of the people are very happy. Those whose hand had to be held when they were coming for the surgery, now they came for the review themselves, and they are all testifying to the good outcomes of the surgery. And that, in a long way, has helped to reduce the fear that people had when you mentioned cataract surgery to them. As we came today, most of the people who had been screened earlier, who benefit from the cataract surgery, who did not come because of fear, most of them have come now, and they are ready to have the surgery done. And we have taken note of all those people. At the next opportunity, we shall organize and then come and do the surgeries for them.
Some of the people who recently benefited from a free cataract surgery shared their experiences with City News.
I went there on the 10th of May, and on the 11th, that they made the surgery. In fact, I'm very glad that I can see clear. It isn't like the other day when I went there. So I'm very happy that they have done this thing for me. Now I can identify anything, whatever I see, I know I'm clear. Even I can say that it is clearer than when I was born. So I'm advising the people that whosoever is there mustn't steer, he mustn't entertain any fears, for there is no mistake in it, and there's no pain. When they make it for you, you become very well as it is, and you can go to your work at any time. So they shouldn't fear. That is what I'm advising them. Now I can see well. So I thank the SDA hospital of what they have done for me.
Kaneno dia na me kwa fomu na me brepa me hwe dia menteme hwe me prapra manem sa na me kwa Sunyani ba e dia me hu ade pa na no me dware ma hu me boyro me se Sunyani dia ye pa nte ye ma ye bo me papa
emi hu ade papa Siminam Kurana, Esamina, Damanim, Sisi, Yamamipa, Madaroma, Dr. Daroma, Yamamipa. I want to come be so, which me far, dear, which me dear. Oh, my Acadia, Mamma, want to put you say, a year pa, which me quiet. Oh, my Binom, when Binom say, Uqua, a year crown, my vessel, Abba, and Chabiana Sanaba, Miss Wamoboa. So put you in a mouth.
Dr. Tinjima shares his thoughts on what could be done to reduce cataract cases in the Bono region.
For the whole Bono region, there are 2 ophthalmologists who are actively working. That is woefully inadequate compared to what the WHO requires, that for every 250,000 population, there should be at least 1 ophthalmologist giving services. Okay, but for a population of about 1.2 million, there are only 2 ophthalmologists. And that is woefully inadequate. So going forward, we need to ensure that we have more people to provide the service, and also they are well resourced, they are equipped, the equipment that they need to be able to perform the services for people, and also the consumables that they need, they are regularly provided, so that people who are blind from treatable causes like cataracts can have their vision restored.